Afya power.
Power.
Solidarity.
Forever.
So, my fellow unionists and the members of the fourth estate, my name is Wachira Peterson. I am the National Chair for Kenya Union of Clinical Officers. I am also the Chair for Health Union Caucus that brings together the unions that represent health workers, together with also the Kenya Health Professional Society that represents those who are not unionized. So I'm here with a representative from the different unions that we have in the health sector, from Canaan for nurses to Kunad for nutritionists, and all the unions representing the health sector. So we came to Nakuru because of the outcry that we have been hearing, not only from our healthcare workers who have been terminated unfairly, but also to the public who are suffering from the shortage emanating from lack of services that these officers were providing. We had an opportunity to visit the outpatient and the inpatient in the Nakuru Level 5 hospital, known as the PGH. And I can tell you the situation there is chaotic because the clinic officers who are there previously have been terminated, and those who were being engaged in a very funny manner, they even refused to report. The things we have found here are really worrying. And I must say that as a country, we must be serious about what we want to do with our health and the direction we want to take in terms of healthcare. The issue of contracts that we have seen here, we have seen that the people standing behind me, employed or engaged since 2019 on short-term contracts under 6 months, which is against the law, for 4 years. They have never been given any gratuity. Nobody can be allowed to go and further their education. They did not qualify for any pension. There is no way of that person being able to develop themselves and being engaged like casual workers. And we are talking about the health sector. And this cuts across all the cadres from the doctor to the mortician. And it's very unfortunate. And the most unfortunate being that the governor, Nakuru County, Governor Kihika, we supported her as the health sector because when she was coming in, she actually promised that she was going to ensure that she harmonizes the terms and that all health workers would actually be on permanent and pensionable. We are seeing even those who are now being replaced. And by the way, you know, we are being told that the reason as to why they disengaged the officers who we are here today with, who are under contract, is because they wanted to abide by the law and ensure that they harmonize process and bring in the sanity. But those people who have been sent to replace them, there has been no advert. There has been no interview. They were simply disengaged, and people are appearing in hospitals that they have been engaged. They don't even have any paper to go and work there. We actually do not even know if they are officers, as we are being told, if they are qualified officers who are supposed to be working there. And we cannot be propagating the same thing that we are saying that we are trying to cure. As unions, our stand still remains that any contract, whether hospital-based, whether county-based, is irregular. Contracts in this country are guided by Public Service Commission Act of 2017. And it provides very clearly that the only time you engage a civil servant, because this is civil service, this is not the private sector, the only time you are going to engage a professional on a term of contract is when the service that they are going to render has an expiry date, has a time frame, or is an emergency, or it's an expertise that has not been there. So let me say that it's very unfortunate what is happening here. And I can say without doubt that these workers have been subjected to unfair termination in the context of Employment Act, the Labor Relation, and even the Public Service Commission Act, and that even the contracts that are being given are irregular.
Ile kitu moja ningependa kuambia Madam Susan, our governor, is we are losing skills. Our people are going. Na tukiangalia wakati wa COVID, kila mtu aliambiwa akae kwao. Kila mtu alitipiwa nyumbani. Sasa ukiangalia every day utaona nurses, clinic officers are going. Why? Because we are not recognized nyumbani kwetu. So, ile kitu tunaomba, sio vita, sio nini, tunaomba angalie sana, because mambo ikienda mbaya, hapa Nakuru ndio utaenda. Hii General Hospital PGH ndio utakuja kuonekana. So tukipoteza wale watu wazuri, na ukiona wale wanaenda nje ni wale wazuri. Watu wamesoma, wako na skills, ndio wanaenda. Tunaachwa na nani? We are getting aged. Kama hatuta retain na tufundize hao watoto wetu sahihi, we are going nowhere. Miaka ikienda 10 from now, ukikuja hapa, itakuwa disaster.
Mary Boniface, I'm the National Treasurer, Kenya Union of Clinical Officers. I'll start by saying this. For healthcare systems to function, there are 6 pillars that must all work together for us to see results. And today, 2 of those pillars have been affected severely by what the county government of Nakuru has done. And these 2 pillars are the human resources for health and governance. We cannot talk of citizens being able to access healthcare when the service provider is not there. And those that are there are overworked, burned out, and extremely tired. And then when that happens, the public comes back to us to blame us, the healthcare workers, that we are misdiagnosing them, that we are not giving them the attention they need. But it was not our fault. It is because we are tired. We have been overworked. And our employers, when we decry of shortage and expecting that they should be employing, actually they are disengaging the people that are supposed to be helping us give services to the citizens. So for how long are we going to look at healthcare as just another sector and not as serious as it's supposed to be for this nation to be able to move forward? So for this we say, and we ask the county government of Nakuru to look back and look at the people that they have laid down and get them to work and actually advertise for more, because there has been shortage even when they were working. So it can only get worse now that they have laid down people.